This is Modern Dental Assisting, Chapter 34, Part 2. In this portion of the lecture, we're going to go over our instrument classification in more detail. Starting with examination instruments, these are the most often utilized instruments on the tray, and we can use these in procedures ranging from checking a specific problem, providing a thorough oral examination, and evaluating a restored tooth. Next, we'll talk about the basic setup. For every procedure, we're going to have ready a mouth mirror, explorer, and cotton forceps or pliers. And it's best to position explorer first and mirror second on the tray. Next would come our hand cutting instruments. These are placed on the tray setup after the examination instruments. The dentist will have a preference as to what instruments they want included in this selection. A combination of rotary instruments and manual cutting instruments interchangeably throughout the procedure. Following would be our restorative instruments. These are used to place, condense, and carve the restorative dental materials back to reflect the normal anatomy of the tooth. Instruments selected for the tray setup vary with the dentist's preferences and types of dental materials selected for the procedure. Accessory instruments are not necessarily included in the tray setup, but we can pull these from dental cabinets or tubs to be used for many procedures. When additional items are used for a procedure, you must follow proper infection control guidelines regarding disinfection or sterilization of the item before you place it back. Preset cassettes or trays. Hand instruments and related accessories for a given procedure are prepared, stored, and transported together, including examination, hygiene, restorative, crown and bridge, or surgical. Storage tub, supplies, and dental materials for specific procedures can be stored in a covered plastic tub within each operatory. This combination is known as the tub and tray system. We also have color coding systems. This is one of the most convenient and efficient ways to organize instruments and supplies for specific procedures. We would use bands of the same color to separate instruments in procedure type. We would use a tray of the same color and a tub with dental materials being the same color.